Okay, so 1, 2, 3. That's the sound of the coffee pouring. Welcome to the Doctor's Brew. I'm your host, Dr. Abdelaziz Al Khayyab, and with us today is Dr. Hussa Al Oudah, the legend herself.
Hi.
So, everybody, and this is not the usual format of how we dive into things on the brew, but really, she's a legend amongst us trainees. Just to brief you guys on who she is. I knew her before she knew me, before the Doctor's Brew even existed. Dr. Hussa did us all the kindness of looking through kind of like on-calls and just analyzing them down and making a website. What's the name of the website? Med On Call website that kind of puts in the basics of on calls, common word calls, stuff like that. Simple things like how do we correct magnesium, how do we correct potassium real quick, all those kind of those dosages and stuff. She put them all on there. So she has been critical to me, not only performing well in on calls, but also surviving the on call. So I really do thank you.
Thank you so much for this kind of introduction.
I mean every word of it, honestly. So Dr. Hussa is an R1, and yes. What else? Do you mind telling us?
So I'm R1 in Kuwaiti Board of Internal Medicine, and I'm also the chief resident. So I graduated in 2020 from Kuwait University, so in the middle of the pandemic. Then I started working in Farwaniya Hospital. I started with medicine to get it out of the way. That was my plan initially. I never wanted medicine. I hated medicine. I just wanted to get it out of the way. I just wanted to start with it and just, never come back to it. I wanted psychiatry initially, by the way. Yeah.
Really?
Yeah, I really love psychiatry. I still do.
Very cool.
Yeah, so I started with medicine and it was very hectic. We were in the middle of a pandemic. And instead of having 3 months of medicine, I ended up having 6 months of medicine.
6 months?
Yeah, so half of my intern
year.
Wait,
how come? Why was it extended?
Because due to COVID, we used to have like 2 months of public health. And those months are either in medicine or you remember the vaccine centers and the stuff. We had to work there or in the medical wards.
Oh, okay.
So they choose for you. And even during my surgery rotation, they kind of forced me to go back to medicine. So half of my year was in medicine.
So they kind of brainwashed you into medicine.
Exactly,
is that fair to say?
exactly. It was very bad. During the first week, they had to throw me in a COVID ward, and they were like, "Okay, this is life. You have to deal with it." And I had like 7 to 8 patients per day. It was very hectic. Wow. But this is the only way I really knew that I wanted to do this for the rest of my life. Like during the first month, I know that, okay, I don't want to leave here. Even during my other rotations, I used to just like go work with them for the few hours. And then as soon as I can leave, I go back to my medical unit and help them out. Wow. So yeah, that's how it started, my love for medicine, I guess.
So I guess something was born out of the pandemic that was positive for Kuwait.
Yeah, for some reason.
Yeah. Now, before we get into the meat of this podcast, I want to just introduce, first of all, the stuff we're going to get into, like you probably assume by now, we're going to be talking about on-calls, everything on-calls, and that's where all the interesting stuff happens. So I think it's an awesome topic to discuss. I know plenty of people want to hear about it. And for those incoming trainee doctors, please listen to this or watch this so that you don't go in blind like I did.
We all did.
We all did, yeah. Now, a few shout-outs to make. Of course, I need to shout out Studio Stretch, as I've done before. They are located in Shueikh. Basically, you go in, you do a quick stretch. Someone can help stretch you out. One of their, I want to stretchologists, I think is the proper term for it. They're super great. They're super friendly. And I've said it before, and since we're talking about on-calls, it's great after an on-call if you're all tensed up. So Studio Stretch. There we go. And also, I want to shout out Dream Med Scrubs. Dream Med Scrubs are a local scrubs brand, and by local, I mean the UAE, so local to the Arab world. Super comfy. Please check out their website, order from them, use the discount code that we've provided. Really, guys, can't recommend them enough. I've been wearing them. I just wore them this morning. That's why I had to change. Yeah, they're really great for the award, and I really do support us, like supporting local. Can't emphasize it enough. Now before we get into it, it's very important discuss the coffee. Today's coffee was brought to us by Dr. Hussa. She was very nice Okay. I was like, we have plenty of coffee here at the Doctor's Brew, yet she managed to supply the brew to the Doctor's Brew today. So thank you very much for
You're
that.
welcome.
Tell us, what did we order today?
Cold brew.
Cold brew?
Yeah.
Really?
Yes, that's my favorite.
Oh, okay. I'm gonna tell you some blasphemy I've done with cold brew before. I want to get your opinion.
Okay.
First of all, I apologize to all our viewers for what I'm about to say. I used to put a little bit of cold milk in my cold brew.
Why? It doesn't need any milk.
Just to break it off that intensity, just a smidge.
Well, if it helps you, then I guess that's fine.
See, so nice, so sweet. Me, on the other hand, when someone comes on the podcast doesn't drink coffee, I shame them. So
You shouldn't judge people for what they drink.
I mean...
Well, you are the Doctor's Brew.
Agree to disagree. I think I will not judge you for the... No, wait,
You
hold on.
will judge me.
Hold on. I'm going to tell you who I judge. Some of my fellow trainees, and I made it right now, and they know who they are, okay? They'll go into Starbucks and they'll get like some iced Americano with 2 pumps of sugar-free chocolate with whipped cream. I don't know what.
I do judge them then.
We got the approval. There we go. You are judged. You are condemned. Nice. Okay, perfect. Let's dive into things here. So we know a little bit about you. You studied in Kuwait.
Yes.
You're now in internal medicine. Okay, but let's backtrack a little bit before internal medicine, before med school. Why medicine as a whole?
Okay, so you probably won't believe this story, but I'll tell it anyway. So I was always an A student, but I never really knew what I wanted to do with my life. I actually didn't like science that much. I enjoyed art, philosophy, psychology, but I ended up in, just assuming that I would be an engineer, just like my parents, and I just did it all the way up until graduation. So after graduation, I tried to log into the system, the Kuwait University system, and it didn't work with me. So I had to use another password, forget my password. It didn't work at all. So I had to call them, and they asked me to come to Khaldiya, the campus, Kuwait University campus. So I had to go there and do it manually. When I went, fortunately, the girl sitting there, I knew her before. She was a friend. So she came and helped me with everything, with the setup, and she changed the password and everything.
Sure.
And once she saw my grades, she was like, mashallah, طب. So basically she said, I never thought of medicine. And once she brought it up,
she implanted the idea.
Light bulb moment. I was like, wait, why did I never consider medicine? Why? When you know that you're good, but you never thought that you're good enough for this. I never knew any doctors in my life, so I thought this is something unattainable, something that, it's too far away. It's not. Me, a doctor. How would I be a doctor? What even is being a doctor? So I sat there thinking. I called my parents, I called everyone. She was like, take your time, you could sit. Fortunately, I knew the girl. Otherwise, she would just, then she started noticing how nervous I got. And she said, you know what? You probably won't get accepted. And I was like, why? And now I wanted more. Now I wanted more. Why wouldn't I get accepted?
Yeah.
So she said, okay, so your grade is really good. You were 97. But because you failed chemistry, and then I remembered during the entrance exam, I just answered the English and maths, and once I reached to the chemistry part, I was like, okay, I don't need it for engineering.
Wait, there's an entrance exam into...
Yeah, for KU. You have to, not entrance, امتحان قدرات.
Okay,
you do
to
it,
see your level.
Yeah, your level, and then it gets added to your GPA at the end. So you might go down 10 marks or something. Yeah.
Wow.
So what happened is, once I reached to the chemistry part, I just started to fill the Scranton sheet. I was too tired, and I was like, okay, خلاص, I don't need it. I'll get accepted to engineering anyways. So I just randomly put any answers, and I got 58. So for engineering, it was I could enter.
Yeah.
قبول فوري, you will get in. We will do your schedule now. Guaranteed. But if you want medicine, your grade will go from 97 all the way to 89. And I was like, 89? I never was an 80s person.
Yeah.
How is it an 89? She was like, you know what? Last year they accepted until 89.9, and your grade now is 89.8, I think. And she was like, only these couple of years they went down to 89 for some reason. All the other years, medicine needs a GPA of above 90% or something.
Right.
Now it's maybe 95. So she said, like most likely you won't get accepted. And so I was like, okay, then I'd rather them kicking me out than me never trying to be a doctor. You know what? Just put it there, and we'll see. They won't accept me. And she probably thought I'm crazy. She was like, okay, sure, I'll put it. So I went back home. I started overthinking for 2 weeks. I was like, okay, like, what am I doing with my life? Do I really want to be a doctor? I called her multiple times. She tried to enter and she couldn't enter my account again for some reason. It was locked. And she was like, خلاص, nakhira, whatever. It's okay. You can always change. You can always leave medicine if you didn't like it. I was like, okay. But I knew myself. I know I wouldn't leave it. If I started something, I would probably want to know more about it, you know?
Yeah, makes sense.
So I got accepted, and people were happy because they got accepted. And on the other hand, I was panicking, and I decided to not think about it and just start and see where things go. So I started, and during our first day, they told us that out of 200, we'll kick 100.
Oh, that's sweet. That's nice.
Yeah, and
That's
like
sweet.
only 100 will go to second year. And I was like, yes, perfect. This is my vibe. I love this. I want this. I will.
1 foot out the door.
Yeah, perfect. Yeah, it's just a year. It's fine. I can see what they have, and like if I don't like it, I can leave, or they will kick me. Anyways, so I won't study. I'll keep chill, and what I call it now is like my years of denial. My first 2 years of uni were full of denial. Like I knew I wanted something, but I didn't really want it. But I was not sure what I wanted to do with my life. So I continued like living my high school life while casually being at uni, you know?
Yeah.
I was not really there. I didn't even make friends. I was like, I'm leaving. Why would I make friends? I don't want to. So yeah, then starting, I took 2 years of that. It was very weird. I just passed like randomly. I didn't even get good grades. And then once I started third year, things changed for me. We started studying systems.
Okay.
So it was a bit different now.
So just so I'm not too familiar with the Kuwait.
Yeah, we have 7 years.
7 years, first two.
Four is preclinical.
Okay.
And 3 is clinical.
Okay, and then the first two.
Two is more micro, biochemistry, more basic sciences.
Basic science.
And the third and fourth are more system based. So I started with like hematology, cardiology, endocrine. Yeah, so it's more oriented, you know, it's more medical.
Yeah.
It's still not patients and it's still theory, but it's more medicine than first and second. So I started to like medicine here, but still not really. I passed fourth year, and then once I started working in the hospital, I hated medicine.
Oh.
Yeah, and then, you know what?
So far, there's a few yellow or red flags.
Yeah,
popping
they
up
are.
so far.
That's why I wanted to say the story, because people sometimes think that they don't like something, but it's not really that. You know, what happened is I was actually just anxious. I didn't know what I wanted, and once I went to the hospital, I didn't see any support, you know. Like doctors who were supposed to be our mentors, they were just like yelling at us. They were just expecting us to know things that we didn't really know. You know, we needed guidance.
Yeah.
We didn't need someone to just ask us questions.
You need a podcast that talks about everything non-medical, medical, non. Oh my God, I jumbled up my own ad. I'm teasing. Go ahead.
So what happened is I hated them. But what happened is I thought that I hated medicine, but the reality is I just hated how I feel when I'm in the hospital.
Okay.
So it took me a few years. I learned all about myself. I focused on myself rather on medicine. And after like tackling my anxiety and all the things that were annoying me actually at work, I discovered that I really liked it. It was just my anxiety speaking.
That's amazing.
Yeah, for example, I'll give you an example. The issue was, you know, when like you're a student and you go to the hospital and someone asks you a question in the rounds, and you're like standing there and you don't know what to do. And at that moment, you think that you hate rounds, but you don't. It's just the question, the way they do it. You know, you hit how you feel at that moment.
Yeah.
So I associated that feeling with the hospital rather than the patients and the medicine itself, like the knowledge. So once I worked on that anxiety and worked on my knowledge, things changed 100%. Like, you know the saying, like, knowledge is power?
Yeah.
It is power. You cannot imagine how your confidence can change 100% when you work on your knowledge.
You mean like medical knowledge?
Yeah, in general, like if you're afraid of something, you should learn about it. You should learn more about it rather than just stay in your fear and avoid it, you know?
Yeah. Absolutely.
So that's what happened. I started hating it, and then once I got into the depth, you know, I understood it exactly, and I understood why I didn't enjoy it. I started really understanding myself more, and once I understood myself more, I understood that it's not about medicine. It was more about me dealing with my anxiety, how I felt, how I felt judged by them, you know. And once I worked on that and worked on myself, my knowledge.
But then how did you deflect that? Because that's a big thing to feel like.
It is.
Because, okay, I understand how you might have enjoyed the job, okay? But it's still a big deal to say every time I go into this workplace, I am being triggered with my anxiety and feeling people are judging me, you know? So how were you able to overcome that, though?
Honestly, what I did is during med school, I was stuck with like certain hospitals and certain people, and I kept going back to them, you know. It was like, what do they call it, Stockholm syndrome? I kept like going back to them, and I was tortured, but I wanted to prove a point, and just kept going back. Even when I started training here, I was in a different hospital. And
Which hospital were you?
Let's not mention that. Okay, it was a toxic place.
Okay, we're gonna off air. I'm gonna ask you.
Okay, I will tell you. Okay, so it was not like the whole hospital, but like I didn't feel comfortable. You know, I believe that every person has the place that they will feel more comfortable at.
Absolutely.
I can enjoy Farwania. You might not enjoy it. For example. You might enjoy Amiria, I might not,
I've heard
you know?
Every hospital in Kuwait, every time I've asked anyone about every hospital, toxic.
Yeah,
toxic.
It's different. Like every person
hospital
is definitely different.
Yeah.
So I was not comfortable, and it triggered me, you know. It brought up memories from before graduation, and it was not about the people currently there. It was more about what happened in the past and like everything, how I felt about myself back then.
Absolutely.
And this, like when I graduated, it was post-COVID. So not post-COVID, like during COVID. So it was
hectic.
Very hectic. The hospitals, like, I know we'll get into on-calls, but during my first on-call, I literally cried in the ward because the patient was hypotensive.
Oh my
I was like, I don't know what I'll do. And I just started sobbing. And the sister, the nurse, she hugged me. She was like, it's okay, doctor. He's just hypotensive. I'm like, no, he'll die. And, you know, it's very hectic.
It is.
So what happened, and I'm not recommending this to anyone.
Not endorsed.
Not endorsed. But what happened is I proved a point to myself. What happened is during one of the days, I randomly drove off. I just left.
Okay.
I decided that I talked to them, of course. I didn't ditch them and like throw my patients.
Wait,
at
on
them.
call or like just
no,
a
just
work
a regular day.
Work day, you just went.
Yeah, I was like, listen. Yeah, I was listen.
Okay.
I talked to the consultant. I was listen.
Sure.
I'm sorry. I'm not finding it helpful here. I cannot give, and like it's not reciprocated, you know. The vibes are not vibing. I cannot be here, you know. We're not on the same.
We're
team.
not on the same frequency right now.
Yeah, like, we're not on the same page. Like,
we're not vibrating at the right.
At all. I tried my best. Like I stayed for a month. Can
I just really say you sound very Gen Z though right now? Like the vibes are not
I know,
there
but
right
I'm
now.
millennial. By the way.
Wait, which year?
1995.
Is that millennial?
I'm not sure, but
oh no, it is
not
millennial.
Gen Z, yeah.
No, yeah, you're right.
Yeah, it is.
Yeah.
It is.
I don't know. 98. Am I millennial?
What year are you?
98.
I think you're in the gray zone. I'm not sure.
I'm just gonna say I'm a millennial because I think it's cooler than Gen Z. Sorry, Gen Z.
Well,
you weren't vibing.
Yeah, I was not vibing at all, and they took it the wrong way. Obviously, they weren't like happy for me for finding myself.
They just clap and be like, "Thank you."
They were like, "Okay, we'll fail you," and they put like 20 out of 30.
No.
Yeah, but I was like, "Okay, bye."
Wait, sorry, I'm getting shocked right now because
I know.
Can I just tell you all, this is the great Hussa Oudah. I'm not even joking. Everybody on the ward, you know how many times she's like, Hussa Oudah, oh, qawiyya. Wow, she's so smart.
That
mashallah.
was the moment I realized I was qawiyya. Like from 1995 up until like 2021 February.
Okay.
It took me like, how many years are that? I know, I'm not sure. But it took me a lot of years to realize that I can actually make a difference. I can actually do something.
Wow.
I was always like, confined, restricted. And once that moment, I know it might sound dramatic that like me leaving the hospital made me a powerful person, but it did, because I realized that we're not really stuck anywhere. We can do whatever we want to do if we put our minds into it and actually start it and plan it. And I know it's a bit weird, but like needed a fresh start. I just needed that. Like staying in a place that had so many bad memories was not helping. And the old Hussa would have thought that, you should face your problems, you shouldn't just run away, but that's not always the case.
And you weren't running away.
Exactly. Although it felt like it at first. I felt like,
Yeah.
what am I doing with my life? Why am I just leaving? I shouldn't. I should face it and,
But
prove
you are
to
facing
them.
it, but in a different way.
Exactly. But I
Yeah.
didn't realize that until later. Like at that moment when I just left, at first it didn't feel brave at first. It felt a bit weird. Like, what am I doing? Am I leaving the whole industry? Like, am I leaving the Ministry of Health? Why
Yeah.
am I just driving away,
Yeah.
And the next day I had a meeting with Kim's and I went and I was like, listen, I really want to be a good doctor. I just need the right environment for me. This is not working for me. It doesn't mean that this place is bad or that I'm bad or like you're bad or like no one's to
No
blame.
hard feelings.
Yeah, no hard feelings. I'm okay and I don't really mind them putting any grades they want to put.
Yeah.
And even if you want me to repeat that month in another hospital, I really don't mind it. He was like, no, you don't have to repeat it. They'll just have to grade you. And you can like go and continue in another hospital. And when I told them, the hospital, they were thrilled that they can grade me, they can evaluate me for what I did. So that's why they put 20 out of 30.
Oh, so they were happy to kind of get revenge.
Yeah, that was, it was weird. I won't get into details. We can discuss that later.
Yeah, all I'm gonna say is zoinks, okay?
Yeah, but what happened is I just left.
Yeah.
The second day, like right after it, like the second day, I'm in a new hospital, new personality, like now we'll start again. Now
I feel like you had a cape flowing, like
yeah, I
a
was
superhero
like,
cape.
hello, this is Dr. Hussa, like I went from
2.0.
Yeah, exactly. It was
Yeah,
like
yeah.
an upgrade,
Yeah.
and things started to, like, I had a different image of myself, if that makes sense. Like, I saw myself differently during that day. And things just changed from that moment.
That's great.
Instead of, even psychiatry. My love for psychiatry was more of love of understanding myself, It wasn't, I like psychology. I love it. I still do. I read about it. I'm all about, personalities.
Who's your favorite psychologist, psychiatrist?
No one.
Amazing answer.
I know.
20 out of 10.
So yeah, that's what happened. So I realized that, okay, I actually like medicine now that I'm in a comfortable space. I'm in a safe environment.
Yeah.
Now I can study. I can flourish.
Absolutely.
And it started here. My first on-call in a different hospital.
And what was it like?
It was very hectic. We had 14 words, if I'm not mistaken, and we were...
Medicine, right?
Yep,
Okay.
medicine, COVID and non-COVID, because we had separate COVID wards. There were 3 or 4. And when you have a COVID ward, it's filled with pneumonia. And all of them are either going into desaturation, pulmonary embolism, ARDS, they're all dying. They're all... Yeah. I finally understood oxygen during that period, nasal cannula, face mask, FiO2, the concentration, high flow machine, BiPAP, CPAP. I never really understood it before that moment.
Yeah, no.
You are in a situation that patient is on 40-liter high flow and their saturation is 60 and they're happy. And they're like, okay. They have no symptoms at all. They call it hypoxia, and it was very bad. People were dying and they were not complaining.
Well, actually, an oxygen thing, I realized, and while I was working in medicine, I realized something. So my dad, when he had, he eventually was on long-term oxygen, okay, because he had lung cancer. And I was, I was his on-call doctor. And so at home, his target saturations were quite low, in the 80s, So, I'd see my dad's saturations 80, 89. And I was happy. I was like, oh, awesome, great. keep going with my day. And what I realized was that on the wards, that was not very smart. So there would be patients who are like, doctor, patient saturation 82. I'm like, it's fine. And then I realized when I was actually talking about managing that that's not okay. You know?
This is not okay at all.
At all. And
now you know, I'm glad.
And so that what it goes to show you is how the experience changes your theoretical knowledge.
Exactly.
You can think in your head, I want oxygen to be 100% all the time, but it's only when you're working that you actually realize what that implication, how to manage
and that you don't really want it at 100%.
Yeah.
You know, that's amazing, actually. So what happened is, it was just me and another person, like another trainee. And in Farwania Hospital, the assistants cover the ER. So they're not with us in the wards. So the 14, 13 wards are distributed among like 2 trainees or 3.
Okay, so how was the new hospital? Now you've left the old hospital, new energy, new force going into, it was Farwania.
Yes, it was Farwania Hospital.
Yes.
It was like starting all over. I needed a fresh start, and it was amazing. It felt like I just graduated again, you know? Although I was just graduated like a few months back, but starting in a new hospital, not knowing the people there, having no idea, it's like going to another country, honestly. Even the population is different, the patients are different, the cases.
I heard Farwania is the most diverse.
It is. It's amazing. You see things like from Africa. You can see the randomest infections. You see all sorts of TB. Like
all sorts of TB.
All sorts. Like
not one kind of TB.
No, just one kind. You see like Pott's disease and like Still's disease. You see like all the weird rheumatological, you see everything.
Basically internal medicine playground.
Exactly. Okay. It was amazing. And I know like the turnover is really fast and the patients keep changing. You get new patients every day, every few days, and you actually discharge patients. They don't stay forever in the hospital like other hospitals. No, we have chronics, but not as much.
Yeah.
The population is a bit younger and more diverse from all over the world, literally. Even the prison cases, they come to us.
Right.
And from airport, patients who come from airport and something happens in the plane, they come to us. So the population is usually you can't even talk. You had like to translate. You get random porters. You might take a full history with like sign language.
Right. Wow.
And you have to really understand and depend on your like clinical judgment and the signs and actually examining patients. And it's really nice. I loved it in Farwania. So what happened is I started and it was mid-pandemic and we were only a few trainees in every unit.
Yeah.
And we had more wards since it's COVID. So we have COVID wards and non-COVID wards. So in total we had around 13 to 14 wards.
This was during a normal day or on call?
On calls.
Okay.
We had to cover 14 wards.
Okay.
And during the working day, we had separate teams. Like the COVID team is a separate team than the medical team. And I was in the COVID team. So during on-calls, we were just 2 trainees. What we used to do is instead of waiting for the ward calls, we would enter the wards one by one and see who's sick in that ward. Yeah, basically preventative medicine. We went into the ward and we saw all the sick patients. We like split the ward, do all the calls, and then move to the next ward. And it was actually good doing it with a friend. We were not friends before, so I met her at that time. She's a pediatric resident now. But at that time, it was the best thing ever. We learned how to do an on-call together. So we were both really nerds. So what we did is we started approaching medicine like the other way. Instead of seeing medicine as diseases, we started seeing them as symptoms, as complaints. What is the cold? Like the nurse calls me and she says, the patient BP is dropping. What does that mean? What's the algorithm in my head?
Yeah.
At first, I didn't have anything.
How do I approach?
Exactly. At first, I didn't know. If you told me shock, I can know how to differentiate shock, like distributive. But if you tell me the BP is dropping, I would just stop there and not have no idea what to do next.
Yeah, fluid?
Yeah, like fluid, what, why? Like, what is this? Like, what is BP?
Here's some water.
Yeah, during my first on-call, I literally cried because of hypertension. So I didn't know. Even one time, the BP was high in a patient and the son came to me and he's like, ترضين شنو انتي راضية أمي ضغطها مرتفع.
They love
I was like,
this
what?
line.
Like,
they
what?
love this line.
And I actually answered. I was really terrified and I was like, لا مو راضية. Like, شنو أقول? What am I supposed to say in these situations?
Can I just comment one thing about on-calls?
Please do.
And I've said this before, I think, honestly, if we do two things, we're going to save 80% of on-call time that is wasted. Explain, when a patient is admitted, to the patient and family, what is an on-call doctor?
Exactly.
And what is a treating doctor?
Exactly.
A treating doctor is the doctor that decides the plan. The on-call is there for emergencies.
Exactly.
Don't call me at 2 a.m. and be like,
Explain.
شنو حالة أمي? I'm like, I don't know.
أنت شو ما تعرف شيء؟ شلون صرت دكتور؟
Thank you. ما تقدر تقلب السيستم? I'm like, no, I can't. Please, no.
ما أقدر.
So that's one. Two, if we just stick to family visiting times.
And if we have social workers, like proper social workers, proper PRO, proper, like we're doing everyone's job, you know, except being doctors.
Exactly.
I end up printing, getting like ink, and like working the IT system.
And it's a problem because that's waste of your time.
It is. We just need improvement in the system. If that happened, we would be better doctors.
I definitely agree.
Yeah, we waste so much of our time doing unnecessary stuff.
What was your worst on-call story?
Well, to be honest, they're too traumatizing. I don't even remember after that. It goes blank. Yeah.
Okay.
Yeah, but you know, I'd rather the busy on-calls rather than the like difficult patients and relatives. I'd rather like, I'm sorry to say this, but like a sick patient, I would know how to deal with them. But a difficult relative who's shouting at you, it gets I'm already anxious. I don't need you to make me more anxious about my life and my life decisions.
No, the problem that I've seen with why I find it an issue is because, how can I put it? I feel bad. I've been in that place where I was the relative that was scared and confused.
Exactly.
I've been there. But the thing is, I also have a patient at the same time who needs their antibiotics. And I can't explain to you what's happening to your relative because you missed the ward round at 9 a.m.
Exactly. You can be at an arrest and a relative from the next room would be like, ليش ما قعدتين حق أمي?
Yes.
I was like, the woman is dying. The woman next door is dead. I'm trying to bring her back to life and you're annoyed that it's too cold in the room.
Yeah.
I'm sorry, but I can't. I need to choose. I need to prioritize. And they won't get it. So you need to just smile and wave and try to be as calm as you can.
I had a moment of, like, I got very disappointed. I think once I was speaking to a patient's relative and kind of was explaining, hey, like, there was a patient who was dying. Did you not want me to see them? And they kind of just went. I don't remember the exact words, but there was an air of, I don't care. You know,
like, they don't.
You know,
yeah.
And that broke my heart. That was a real moment for me of, wow, humanity is not what I think.
Entitlement.
Yeah. Entitlement is a big deal in the on-call.
It is, and that's why I like Farwani Hospital.
Less entitlement?
Yeah, definitely less. The patient thank you for like being sick. Like they're sick and they're thanking you for your existence.
Can I just say that if anyone is listening that is not necessarily medical and is a patient, just really saying thank you and not the fake thank you, not the يعطيك العافية دكتور and then you're just as you're leaving, you know. I mean a genuine like thank you for doing this makes your night.
It does. And instead what we get is you get home and you find a tweet about you know, like a random tweet like, الدكتورة اليوم and you're like what? That's not true.
Well, there was one patient that I was with in the on-call for a whole hour because they were poor prognosis and they were really anxious. And I tried my best and the patient held my hand and said, thank you, you made me feel heard, God bless you, and
it feels good.
It felt good.
Yeah.
But 1 hour later, but the next day I see on Twitter that apparently he was mad at some other doctors. And it felt like all the stuff that I did just got undone.
Yeah.
It's not a nice feeling.
It's not. And that's why we need to focus on why we are doctors. Because we do this for the patient regardless of how the patient will feel about us, you know? It's not about us.
Absolutely.
It's more about, are they feeling better now? And if they are, that's the most important part of it. And I guess even if one patient thanks you, it can undone what like 100 patients did.
Absolutely.
So it's fine. You'll get like a few nice people every
Right,
once in a
right.
while. Yeah.
It bounces back up.
It does, definitely. So that's why Med on Call happened. It was very traumatizing. It was at the start, I didn't know how to deal with anything.
Can you, before you get into like how did the story, can you just tell us, in case people don't know, what is Med on Call?
Okay, so it's basically a website.
Mm-hmm.
You can enter it, and it's very simple to use, and that was the point of it. I needed it to be like a quick guide of the common word calls that you can get as an intern in medicine. So I'm speaking only about internal medicine. So for example, it's divided into like vitals, complaints, labs. So that's the main calls that you might get. You might get a call about a lab, about calcium, potassium, sodium, hemoglobin, and so on. Or you can get a complaint that the patient said. So for example, I'm having abdominal pain, I'm like vomiting, and so on. So the third part is the vitals. So the BP, heart rate, glucose, oxygen. What happened is it started for me when I was a trainee. I didn't do the website at first. It was more of a notebook that I had for me.
And you made these algorithms yourself?
Yeah, but it wasn't more of an algorithm as much as approach tool. Like how would I approach hypoglycemia? How would I approach, like I knew hypoglycemia in my head and I knew the causes of it, but I didn't really know what to do in case of like, okay, now patient is hypoglycemic, what would I do now?
Yeah, in the
I
moment
won't
of-
be like, okay, let's have a differential. It's not like that in an emergency setting. You need to stabilize the patient. You need to have your ABCs. You need to be quick and precise in what you ask. So I started writing down before my on-calls what I'm expected to have in that on-call. So like BP, I started with vitals because it's the most emergency setting. So I started with like BP, high, low, heart rate, high, low. And it made me feel really good about my on-calls. I started knowing what to do. And then once I finished my intern year, so I told you I had like 6 months of medicine. So after that, I was like an assistant in internal medicine. So it was February 2022, and my website started like January 31st. So one day before my assistant year, I was like, listen, you might like never have word calls again, but
Oh yeah, right, as an assistant,
yeah, because in Farwaniya, I will just go to the ER. However, new trainees are coming and they have no idea what to do, and why would we let people relive that every year when we know how to deal with it?
The panic of going in for your on-call.
I had people cry like full on panic mode in front of me, and I had to like deal with patients and deal with them because they're panicking and they have no idea what to do, and we cannot blame them.
You can't. It's literally
hectic.
it's life or death. When
It
people are
is.
like, is it something that someone's gonna die over?
Yes. They're gasping. People like, it's very traumatizing. When I tell you that I don't have on-call stories, it's probably because I was in fight or flight. I had to save lives and just move on. And once it's done, it's like, okay, it's over. Let's have a meal and watch an episode and pretend that nothing happened. You know, we're traumatized every 5 days, and it's a lot. So in order to decrease that trauma and make it more of a learning experience, I need to actually learn. Like, how would I just go into it and expect to know everything? Even if I said it's 7 years or 8 years or even 10 years of medicine, it's different. It's not theory. These are patients. These are people. So I was like, okay, like I won't have word calls again, but people will. And if I need a selfish reason, the trainees will call me as an assistant, and they're expecting me to tell them a full plan. And I noticed trainees, when they panic, for example, for me, I used to see the patient, put a plan, and then call the assistant and approve of the plan before doing it. Because as a trainee, I didn't know. I just graduated. I'm not sure 100% of the plan. And if they approve, I would move on and do the plan. So I was like, okay, now I'm the assistant. They will call me for the approval. I better know what I'm doing. I was the trainee yesterday. Today, I'll be the assistant. So I was like, okay, let's make my life and their life easier by having a reference. Medicine is medicine.
You know, it's a theme with you. You're being prophylactic. You're preventative.
Exactly. That's what I learned from my anxiety. When you're anxious, you learn how to prevent anxiety. It's not always treatable. Sometimes you need to stop it before it happens.
That's smart. That's
Even
really
if
smart.
you'll have both ways, like of course you'll treat the anxiety,
Mm-hmm.
but on the other hand you need to make it less frequent. And how do you make it less frequent? By preparing. Like it's from the simplest thing, like preparing your clothes the night before, you know, like sleeping early so you can wake up tomorrow, studying for an exam so you can ace it. So it's the same thing. So you need to study for an on-call. It's actually something worth studying for. You'll have it every 5 days. Why would you want to die every 5 days?
Of course.
Why? I'd rather be prepared for it. So that's what happened. I started searching, and now it's not just for me, it's for thousands of people. So I need like the information to be 100% true. And at the end of the day, like medicine is individualized. I know medicine is medicine, but each patient is different. You cannot generalize. And I think you notice, like I keep saying in the website, like every patient is individualized. Call your senior, make sure whatever. Like you cannot just generalize and put a plan for everyone in the hospital. They're different. So that's what happened. I started like doing a theme and mentioning the most common word calls and like vitals, complaints, and so on. And I started getting the information from trusted sources, like, and making it more experience-based, like things that I actually did in the hospital. For example, in replacement of like potassium, I couldn't just copy-paste from up to date. Because it's different what we have in the pharmacy. Phosphate, I don't know if you noticed, but phosphate is very random and hard to replace. And depends on what you have in the pharmacy, and you end up like begging the pharmacist to help you out with the number and doses because you're not sure, and you have so many options and up to date. So that's what I did. So I had like pharmacists help me. I asked everyone. I even asked one of the regs in Farwania Hospital, one of the senior, the specialists, the head of department, Dr. Naila Al-Mazidi. She reviewed the website with me.
Oh, really?
Yes, everyone did.
Amazing.
Like Dr. Muhammad Reza, Dr. Altaf Al-Qadiri, Talal Al-Aradi.
It's such an amazing idea what you did.
They're amazing. Like they all backed me up. Everyone reviewed it with me. They kept reviewing. I kept sending it every single day. Like, I changed this word. Like, what do you think of this? Like, is it random blood sugar or glucose? Like, can I say sugar? Can I say glucose? Like, what's the... I kept, like, bugging them every single day because I didn't want people to have something that's not 100% accurate. And at the end of the day, it's people. I cannot, like, send something out there and be like, okay, but... I'm not sure, but here you go. I need to be sure
it
of
has
it.
implications, real world implications.
Exactly. So I kept reviewing it. I still do. Every weekend or so, I open it. I'm like, let's read. Because I like, especially when the views are getting up now, like it's almost 20,000 views.
Wow.
Yeah, from the start. So like many people are there. And
you made a medical resource, a brand new medical resource.
I did, for Kuwait. And it's scary. It really is.
But it's so you should be so proud because what's the benefit of it is the fact that it's digital. Imagine if it was a journal and someone's going in like, okay,
we had one before, and it's amazing, but it's like it's too big. Like I cannot like pulmonary embolism, like what to do. Like I cannot read it, and the patient is here, and like, what are you doing, doctor? Like, you're searching. Are you not sure of how to deal with my dad? No, okay, like I need to read. So the website was that's why I'm a bit. It's a bit hard now to expand because I don't want it to be a lot. I need it to be precise and to point. And that's the issue. That's another issue that I'm dealing with now. I want to expand, but I don't know how to expand without making it extensive. Yeah, so that's another thing. But so far, I think it covers the most important things.
Definitely.
It does. Maybe I might add like ER-related casualty, but yeah, still working on it, I guess.
I mean, what I used it for word salad. What I did was I realized like I kept looking these things up and I kept being so nervous. So what I did is every time I got a call, let's say, I don't know, magnesium low. Every time I would open up the website, check magnesium, check the levels, check the treatment, even if I knew.
Exactly.
I did it a few times, and then by the last time, we're good. It now. We're done. We're cruising.
That's the point. Because with time, you'll know how to research things. You'll know how to study things. What's the important thing? But meanwhile, until you're at that level,
training
you need
wheels.
some help. You need some help. You need a push, and then you can do it by your own. For example, you get word calls that not in any book or any website. But you
Difficult
still-
family member, what do I do?
Exactly. And I will not have a page on that.
Smart.
Yeah, I have
Smart.
agitated patient because it's about the patient, but not the family. Definitely not the family.
Now, with on-calls, do you think that the fact that this resource has been made, what do you think is this a reflection of? Do you think that this reflects that the way we approach on-calls in Kuwait may be that we're underarming our trainees or incoming doctors?
Well, I think no one really told us how it's like. It's very confusing.
Very.
You study something and you're just thrown into a hospital and someone tells you, okay, this is the word, they have your number, they might call you for anything.
Yeah.
And you're like, okay, okay, and you
It's
just
like
wait.
an OSCE all the time.
Exactly. It's like you're just holding your phone and waiting for a phone call and praying it's something stupid, so you actually can do it.
Yeah.
And hoping that no one dies.
Please
You're
just tell me-
praying, no one's dying during my
Literally.
own call. So it's very stressful. It's
Extremely.
very anxiety provoking. I end up having palpitations the whole time. So I needed something. And that's why I believe knowledge is power. Because once you learn more, you can deal with those stuff and your anxiety would be less. And yeah, I think I did it because of the confusion around on calls. And because sometimes during those times, no one can really help you. It's really
No.
hard to ask for help. Even though people are helpful, people do help you, but
I've never had anyone not be helpful.
yeah, people do
Never.
help you, but they're also struggling.
Yes.
They're dealing with so much and covering on calls, like you have 2 words, another person has 2 words. They can't leave their patients and come save you.
Can I just say also that a lot of the issue with on-calls is imposter syndrome?
It is, yeah.
Yeah. You feel like, at least for me, I was like, I am not the doctor. I'm a 4th-year medical student
Yeah.
from the University of Manchester, you
Yeah.
know?
Yeah.
Yeah.
It is very hard. Even day-to-day work, you're feeling, it feels very weird.
Yeah, yeah.
Because you're not used to this. You're always used to like having
Yeah.
exams and like passing and someone evaluating you. Even now in residency, I keep telling myself I'm already a doctor.
Yeah.
I'm just training more.
Yeah.
You know, even if they evaluate me, it's fine. I'm a doctor. I'm here for a reason. Yesterday, a patient asked me, they were like, "Are you a doctor?" I'm like, "Yes." I was like, "How many years have you been working as a doctor?" I was like, 3.
Wow.
Yeah, it's hard because people still don't, they need to see like some huge figure
yeah.
to believe that they're a doctor or someone like with a, lab coat. And, you know, so it's hard, especially with like even the population is not helping you.
Yeah.
So no one's really helping you. So you need to work on yourself to get over this.
It's, the thing that with on-calls is where I feel like that's where you do the most learning.
Yeah,
Because
definitely.
you're at your rawest, you're at your, this is who you are. And one thing that it does put to the test is team communication.
It does.
I've been in situations and on calls where the team didn't communicate properly. Some other people's mistakes, some my mistakes. And what you come to realize is that now that you're free, communication is absolutely key.
It is. I always say like you never know someone until you on call with them. It's like you discover like the differences in people. You know what they're really made of during the on-call. Some on-calls pass by very quickly because the team is amazing. Even from the simplest stuff like getting coffee, someone ordering your favorite coffee,
Yeah.
or like bringing sweets, or like checking on you, or like calling you and making sure, or like coming to the word call with you. Those simple things matter.
Yeah.
And if you feel supported, you will excel in your on-calls.
Absolutely.
And that's why I made, like, one of the reasons I made the guide is like, okay, even if no one's supporting you, like, this website is here for you, and I'm here for you. You can ask. One of my friends, she was very anxious during her intern year.
Yeah.
She kept calling me during her on-calls. So I had, like, my on-calls and her on-calls. And I kept, like, giving her plans. And I was like, you know this.
Yeah.
She's like, I know, but I need you to tell me again. I was like, okay. And with time, she started realizing that we all know the same things. It's just a matter of applying it and putting it into test.
The textbook is different to real life.
Exactly, definitely.
I remember Dr. Mohammed Al-Fadala. He was, I think, guest number 3 on the podcast, and one of the assistants in my unit. I remember him telling me how there is a jump from medical student, like the knowledge is all textbooks, to how am I actually going to use this on the ward?
Definitely.
It's not actually as intuitive as you think. It takes
It's
time,
not.
practice. Can I ask you one issue I struggle with in on-calls?
Yeah.
when an on-call doesn't go well for me, I go home and I think I'm an idiot. That happens to me so much, and it feeds into the imposter syndrome. Is that something you ever struggled with?
Well, yeah, almost every on-call. But it gets better.
Really?
It does get better with time. Yeah, definitely it gets better. You get better at it, and you start not only improving as a doctor, but also as a communicator, as you know how to deal with patients, how to talk to nurses, how to get what you want, how to get the other specialties to like help you, how you get it, you get better at, like, you believe in yourself more, so you start actually doing what you always knew how to do, but now actually doing it, you know.
Right.
Yeah, but it does. It's very hard. It's very hard, especially when one thing goes wrong and then the day goes wrong and then the whole thing, and it just like a snowball effect, and you end up feeling like, okay, why am I doing this? Do I really want this? Do I want to leave? Am I doing the right thing? Did someone die because of me?
And you're sleep deprived the whole time.
Yeah, exactly. Especially if it's the night shift.
Yeah.
They're the worst.
Absolutely.
But it does get better, if that makes you feel better. It does get better.
Thank you. Now, I have one last parting question, but it's a long question.
Take your time.
Now, I want you to imagine that I am a trainee who just came out of university, which is easy to imagine because I am a trainee.
Who just came out of university.
Yeah, pretty much. I just have a few months of experience, which, okay, doesn't do much. But anyways, so I want you to tell me what you wish someone told you when you were in that position. What would you tell me?
Okay, so I would start with, it's okay. It's definitely okay.
Tears.
Yeah, you can cry. We all cried. And it's fine to have no idea what you're doing, especially at first. You're not a student anymore, and it's different. It's different now. You're actually a doctor, and you need to know what is your style in being a doctor, because it's different. Like, every person has a different style. Just because your consultant does things this way doesn't mean that it's the right way. And just because they teach you one thing to do things, it doesn't mean that this is the right way to do it. So one thing that really helped me is going back and learning from the right source. Like, for example, how do I take a proper history? It's okay. It's never too late to learn how to take a proper history, how to do a proper examination. And once you get those in order, no one else can make you feel less about yourself, because you know what you're talking about. And you need to work on your communication, on your teamwork, how to deal with difficult doctors, difficult consultants, difficult patients, it will take time, but it will humble you, and you will start knowing how to deal with things once you start practicing. You won't know from day one. It's okay. We all struggled. It took years. In my third year of the job, and it's still very hard. Some days are better than others, but you need to practice until it will get easier. And what I would say is, don't overshoot with confidence, but don't take yourself lightly. Like, you graduated med school.
You know something.
Yeah, you know something. You know at least one thing. And that's enough. You know, like, you are good enough for this. You have a certificate that says so, even if you don't believe in it.
Yeah.
And be in an environment that's helpful for you. Choose the place that you thrive in. And I think this is the best thing that I could say. Like, choose a place that you thrive in. Be with the people that you feel that are good for you, for your mental health. It's not just about medicine and the patients and saving lives. You need to be okay. You need to feel good in order to make other people feel good. So changing your mind, giving up some days, changing specialties, still having other options, it's all valid. You don't have to be 100% sure about a specialty from day one. You don't need to know everything from day one. Always ask for help. People are there to help you. Even if like one person said no or like was mean, always move on to the next person. There are so many people in the hospital.
There's plenty of people.
And you can learn from everyone. Like, I always say this, even if your team is the most annoying team in the universe, learn from the subspecialty. I used to join like neurology rounds randomly. Like, I go in and I'm like, oh, what are you doing? What do you have? And they like it. They enjoy it. They're like, oh, you're actually interested and you have questions. So you can learn from everyone. Like, I literally went down to the biochemistry lab and asked them a question. You learn from every person in the hospital,
Absolutely.
from the nurses, from the microbiologists, the ID specialists, the endocrinologist. I used to join random clinics when I have free time. You can just enter and be like, oh, what patients do you have today? Can I help you? Can I read? Like, you can do anything. Don't feel that you're like, oh, it's like too awkward to ask, especially in Kuwait. Like, the people are too afraid to approach and ask for help when it's no one is that mean. Okay, I know we have mean people, but the majority of people are actually nice.
The high majority.
Yeah.
Everyone was warning me about how people are mean, people are mean, people are
They're
mean.
not.
They're the exception.
Yeah. Yeah, you'll see like maybe 5% of people, or like,
Yeah.
and it's fine.
That's the way it is.
You will find them and you will ignore them and avoid them.
Absolutely.
And just stick to the good people, and you will
Absolutely.
find good people every single hospital and every single unit, and you just have to be one, and you will attract one.
Yeah.
Yeah, one of my mentors always said, your vibe will attract your tribe. And it's
I like that.
yeah, I enter the hospital with like the vibe of, okay, I want to learn, I'm enjoying this, even if I don't like the specialty. Like currently I'm doing CCU, and cardiology is not like my favorite. I'm fine with it, but I'm still really enjoying it. Like, oh, you have a shock, okay, like you're seeing an arrhythmia, okay, like you're doing echo. It's really important to go out there and learn stuff, even if you ended up not using that.
So be curious.
Exactly. Be curious and always be a student, like forever, without having that mentality of a student, of like, I'm being judged, everyone hates me, they want to fail me. No one wants to fail you. Especially if you show up and you're doing your job, that's more than enough.
They want you to succeed.
Exactly, they do.
So the key takeaways is, number one, chill out, don't panic, we all mess up.
Exactly.
Number two, your communication skills are going to be weak. There's going to be bad days and good days.
Exactly.
And they get better.
They do.
Then they get worse. And they get better.
Exactly. Like everything in work.
Like everything. Practice, practice, practice. And I really love the point you made about the environment. Because really, I can imagine how you can be the best doctor, whatever, but if you're with the wrong people, the wrong team, the wrong location, it can bring out the worst in you and your colleagues.
Exactly.
The other way. And then that'll make the bad on-call. And then last thing is always learn. Be curious.
Yeah.
Well, a lot to take in. I'm going to try to put this all into practice in my next on-call. For just parting words to anyone who's listening, who's a medical student or a trainee, I can't stress enough how important this website was for my journey and my getting used to on-calls. It helps so much because it's that crutch you need to be able to run, you know? Look up every single thing. These ward calls happen repeatedly, and the more you're exposed to them, the better, because then you can just do them secondhand. Thank you so much for coming on the podcast.
Thank you so much for having me.
And
I really enjoyed this.
It's honestly, it was a pleasure to have you. Are there any things we can expect changing in the website soon, or?
Well, stay tuned. I'm not sure.
Very exciting, even.
Yeah.
Very exciting.
And if someone needs me to add something, just DM me.
Perfect.
And I'll add it.
I always like to offer, is there any social media pages that you want to promote under
sure.
this podcast?
Med on call. Yeah,
Med on call.
medoncall.kw.
So that's on Instagram?
Yes.
Okay, so medoncall.kw.
I hope that's the right. Okay.
I'm sure it is. It'll pop up. medoncall.kw. Check out the Instagram. Support this website and whatever endeavors Dr. Hussa is
Thank
doing.
you so much. But please always search your own as well.
Yes.
Yeah, I this is one thing I wanted to say. Like, never just stick to one source. You know, even okay, this can help you. This is a guide. This is the start. But at the end of the day, you're a researcher. You're a doctor. You're you're in science. You're like a detective.
It can change
exactly
overnight.
Every day. New guidelines are coming up, so you need to have this habit of searching and like looking for new information and knowing how to help your patients.
Right. This is a resource, not a replacement.
Exactly. Please.
Yeah. So thank you again.
Thank you so much.
Well, that's the last sip of coffee for the day. Final special thank you to our guests. Please make sure to follow medoncall.kw. Make sure to support the website. And if you like what you hear and see, make sure to like, comment, subscribe, and we'll see you next time on The Doctor's Brew. Hope you all enjoyed this episode of The Doctor's Brew. New episodes to listen to with a cup of coffee coming your way every Sunday on YouTube and Spotify.
And be sure to follow us on Instagram for all the latest updates. See you next time.